going to read out the questions for you. Is that okay?
Yeah, that's fine.
All right. Thank you. Okay. So here are the questions. This one is a comment. It says, over 10 years is a long time. What can we do to reduce the time scale? And I think
Um,
you shared a bit on that.
um, Everyone's different. Every woman's makeup is different. Everyone's family history is different. And it's kind of dependent on how quickly the ovaries decline over time. So it's an average. It's not that every woman is going to be a 10-year process before they go into menopause. But when they pull, a large amount of women together, they take an average of how long it took for them to go into menopause. They found that on average it was 10 years. Some women are 2, 3 years. Some women do take that prolonged time. So I think it's a little bit out of our hands. The way we don't determine when the menopause happens, we can't determine how quickly we get there or how long it lasts. So my job is to help you navigate that process, or the job of your gynecologist or your doctor is to help you not suffer through, if you are 10 years, not suffer through those 10 years and not suffer through those 14 years. So how can you make your life better? And like I always tell my patients too, who are just seeing me for regular stuff, your periods, your uterus, your fertility should not control your life. It should just be something happening alongside your life. If it's
Oh,
starting to take over your life, then you should do something about it.
beautiful. Thank you. Thank you. And the next question says, does it help if we lose weight and take vitamins?
Great question. Which vitamins? At the beginning, I did say that I check a full panel. I try not to narrow the focus too much. So I check vitamin D, I check B12, I check thyroid. And I told you one of my patients actually, hers was high thyroid hormone that was causing her symptom, not necessarily hormone problem. And so some women who are tired all the time, I find that it's a low vitamin D. So I will replace vitamin D in those women. Um, I did find a woman whose hot flashes got better with losing weight. So she was on Ozempic. She was having some pre-diabetes symptoms, so I was able to get her insurance to cover her Ozempic. She lost maybe 20 pounds and her hot flashes got better. So everyone's a little different. I cannot promise that that will happen for everybody because remember, it's not a weight thing, it's an estrogen thing. The ovaries are losing estrogen. The brain is demanding estrogen with that FSH. The FSH is dysregulating the body. And so I want to say yes and no. It can help, but it might not fully solve the problems.
Thank you. I was gonna ask you if the over-the-counter vitamin D would work or the B12.
Absolutely, they do work. What I do for my patients, if it's very low, especially us African American women, we're not in, we have melanin that doesn't really take, and we're not spending a lot of time in the sun. A lot of us are in our offices, so we're not getting a lot of exposure. So women, by the time I'm checking their vitamin D, it should be 30 and above. I'm seeing number of 6. I'm seeing 11.
Oh,
And so sometimes I just give them vitamin D and I say, come back in a month and let's talk about your energy level at that time. So there's a prescription vitamin D that's once a week.
mhm.
And so that's quicker. They notice within like the first week or two that their energy is up, they're just more motivated, feeling better. And then after I do that for 2 months, then I tell them to take a daily over-the-counter multivitamin to maintain. Unless you're going to be working a lot in the sun, you're going to be exposed to the sun a lot. I would recommend a daily vitamin D as long as your initial baseline vitamin D is not too low.
Thank you. That's awesome. All right. The next one says, how early can a woman start taking steps to help relieve the perimenopause symptoms?
As soon as you feel them. I have patients. Now, average age of menopause is 45 to 55. So, on average, women start noticing that their bodies are changing at age 45. But I have people at 38. Now, they're not menopausal, they're not even perimenopausal, but their testosterone is low. Very busy life, very stressful life, very, very de major demands on their mind, their brain, their energy. So testosterone is low and they start feeling like they're in menopause. So as early as you start noticing symptoms, have your vitamin D checked, B12 checked, testosterone checked. If you have your estrogen checked, it's going to be normal because you're still having periods. But, have the testosterone checked. A lot of OBGYNs are not doing testosterone or are not familiar with testosterone. They'll check your hormones and say your hormones are fine. You're fine, but you're really not.
Mhm.
Testosterone deficiency is a big, big deal that people are not catching. Women are like, but why do I feel this way? You keep telling me I'm fine, but why do I feel this way? And so a lot of people end up seeking out med spas, all these other places that I give them. And so we are trying to educate OBGYNs and general doctors on hormone replacement in general. But as soon as you start noticing that you don't feel like yourself, get blood work, ask questions. Go, watch. I have a ton of videos on YouTube and Instagram. So watch those videos, educate yourself. So when you go to your doctor, you can ask specific questions, right? And then you can let them know it's from an expert. It's not from somebody's blog. It's a physician that's giving these recommendations. And so it's important to know that it's from a reputable person for your doctor to take you seriously.
Beautiful. Thank you. And it's not from Google either.
Right.
So before we go ahead, it's 6:30. I want to appreciate everyone that came. There are a few more questions. Dr. Durowade, do you mind staying just a few more minutes to finish up? I want to respect your time.
Absolutely. I'm happy to answer them.
All right, thank you. And if anyone else that has to leave, I appreciate you and thank you for joining. I'll go ahead and finish up with a few more questions that we had. I believe you did touch upon this. However, someone is asking, just in case they weren't here when you talked about it, how often can you get the vaginal laser therapy and how long does a treatment round last for?
One treatment per month for 3 months. So
All
it's
right.
3 treatments, 1 month apart. If you're on the younger side for 30s, 40s, not fully in menopause, your body's still making some hormone and the treatments will last longer. On average, it lasts about 2, 3 years.
All right.
But if you're fully in menopause, your body's really only making like 5% hormone, 2 years on average, and you only need like one treatment per year to maintain the results. So I find that my younger patients, they're not really coming back after year 2. They're still doing great. But my menopausal patients are like, Doc, I think it's time for my maintenance because they get older, they don't have that much support from their estrogen anymore. So to answer the question, short 2 years on average that it lasts, and then it's one treatment, three
Everything.
treatments 1 month apart.
All right. Okay. And then the other one says, can you take testosterone shot if you have diabetes?
That's the advantage of testosterone. It does not interact with any other medications that you have to take. It is purely hormone, as long as it is plant testosterone, as long as it is bioidentical testosterone from cassava yam. That's the only one I'm vouching for. So you got to make sure that if you are getting testosterone from a physician or an office, ask them what plant is this from, and is it bioidentical? Is it from plants? So it's given as cream or by pellet. So it's not taken by mouth. If you have to take injections for insulin or medications for diabetes, it will not interact with those medicines. If you have to take medications for thyroid or high blood pressure, it does not interact with those medicines. There is no one who is not a good candidate for testosterone, unless they have a testosterone cancer or something. Men who have prostate cancer cannot get testosterone. So for women, we haven't found the woman who cannot get testosterone. No medical condition that makes her not a candidate.
All right. Thank you. Um, as far as VSM goes, what if you do not like to exercise at all?
That's okay. We do in general recommend some type of physical activity. It could be dancing, Zumba. It could be line dancing. So you're looking for something lifestyle to do. Yoga, I know we're Christians. There is some context of, how yoga might be a spiritual thing that might conflict with our faith. I just call it stretching. The moves you're just stretching your body. Like I told you, one of my patients is a yoga instructor. She has a yoga studio and all her symptoms were well controlled. When she came to me, she said, nope, I don't have that. Nope, I don't have that. Nope, I'm only here for low sex drive. So physical, moving your body, stretching. If you don't want anything physical, you can do the stretches. YouTube videos of strength training. You could say strength training for my back, strength training for my leg, stretches, general body stretches. Those can help. But if you don't like to exercise at all, then hormones, or there's also the hormone and the non-hormone profile that can help those symptoms, depending on what symptoms you want to treat. If it is sexual dysfunction, you need hormones. There's no other way around that.
Gotcha. Thank you. The next one says, are suppositories safe to insert twice a week?
I use vaginal moisturizers. There's Replens, there's New Eve, it's an oil. Yes, as far as we know, vaginal moisturizers are safe and do not have an adverse safety profile. Um, they basically are like gels. They're gels that coat the vagina. So it's okay to take them if you don't want to use vaginal estrogen or do any of the laser stuff. Uh, um, they're better than having to go grab a lubricant in the moment, right? Because it's a maintenance thing. So Replens is twice a week. New Eve, I believe, is once or twice a week. Their suppositories that go in the vagina just to maintain the lubrication in there so you don't have to go grab one immediately you want to be active with your partner. So we don't have any studies that show that they cause cancer. So vaginal, over-the-counter vaginal moisturizers are considered to be safe.
All right, thank you. We have three more questions. This one says, how do you improve pelvic floor muscle aside from Kegel exercises?
So pelvic floor therapy. Pelvic floor therapy is the one I was talking about where you work with a therapist
Mhm.
who does exercises with you and for you that build up your pelvic floor muscles. But a lot of times, what they're doing is expert Kegel exercises. A lot of women are doing Kegels the wrong way. Maybe that's why they're not seeing the results. So those women are going to correct the way you do the Kegel exercises. The pelvic floor therapist, they'll give you some exercises to do at home. I have a great relationship with pelvic therapists in my area. And I send patients to them all the time. Their job is to teach you how to do those Kegel exercises or other pelvic floor exercises correctly so those muscles can get stronger.
Very
Or
good.
the vaginal laser is the other option.
Okay, all right, thank you. And then the next one says, how does progesterone replacement play a role in menopause, if any?
Progesterone is usually comes as a cream. In general, progesterone is for uterine protection. Anybody getting estrogen who has a uterus is going to get a period or bleeding, is going to get bleeding because estrogen will stimulate the uterus, except vaginal estrogen. Remember, I talked about vaginal estrogen is kind of topical, like dry, you put in lotion on dry skin. That's what vaginal estrogen is. If you're taking estrogen systemically as a tablet, as a patch, something that is going to go all over the body, progesterone is to counter that estrogen effect at the uterus level. So you don't get periods, or if you do get periods, you are protecting the uterus from uterine cancer that can happen with estrogen replacement. So whenever you give a woman estrogen, you got to make sure she has some type of progesterone. Some women will use progesterone creams to help them sleep at night. I have seen some women who come to me already on those treatments. I try not to change what's working for them. I just try to, okay, so this, you're already on estrogen, you're already on progesterone, this is already working for you. What symptom of menopause are you still going through that hasn't been resolved by these guys? Most women, it's low sex drive, and that's when we get into testosterone conversations.
The last one that says, can I still get pregnant, have children in perimenopause? And I think you touched on that as well.
Um, it's rare.
Okay.
Um, it's rare because the ovaries are declining. You're not ovulating as frequently. If you are in your 50s and still having monthly periods, the answer is yes. If you are perimenopausal and still having and having irregular periods, it's less likely. If you've gone 12 consecutive months without a period, it is not likely that you are going to ovulate and have a pregnancy. Um, so the answer is, can you get pregnant in perimenopause? Depends on if the periods are regular. Remember, at the beginning, I said perimenopause is menopause transition, but your menopause symptoms, but you're still having regular periods or irregular periods. So if periods are still coming, yes. If periods are no longer coming, no.
All right. Thank you very much. Dr. Durowade, how can we follow you?
Absolutely. You can type my name in YouTube. I have a YouTube channel. It's called Dardur Gynecology. Remember, Dardur is my father's name, Dardur Durowade. Um, Dardur Gynecology on YouTube. I have a ton of videos about everything possible on YouTube, about even hair loss is on YouTube. Vaginal pH is on YouTube. Anything, talking to your daughters about their first period is on YouTube. So go to my YouTube channel. I have a bunch of videos there. I'm on Instagram. It's Dr. Durowade, Dardur Gynecology. I'm on LinkedIn. I do have posts my videos on LinkedIn as well. So if you like the professional pages, you don't do any of the social media ones, the videos and stuff and posts are also on LinkedIn as Dr. Taiwo Durowade. Facebook, I'm on Facebook as well. I'm on TikTok as well. So we try to put all our content on all platforms where people might be, women might be, so that there's at least, verified, reputable information out there because people are coming to me having tried the craziest things. And I'm like, I wish more people would follow the reputable pages versus somebody who has no expertise whatsoever but tried something. So doctors are trying to do their best to get content out there so we can counter the misinformation might be out there. So all your social media platforms, you can type in my name, Durowade or Dardur, and you find me and my bright hair there.
Beautiful. So I want to thank you very much, Dr. Taiwo. It's
Absolutely.
a pleasure. I have to stress the fact that you prepared. You
Oh,
gave the time to prepare and you gave the time to come talk to
yeah.
us at no cost, and we sincerely appreciate you. So please, can I have the rest of us just show her some love? Hearts,
Thank
claps,
you. Thank
everything, just to say
you
thank
so
you. She
much.
has charged us nothing
Thank you.
for the preparation and for coming to talk to us. So we really do appreciate you.